so far we have studied that we have certain steps of the approaching any orthodontic patient. And what are those steps? We first of all we collect all the diagnostic data in the form of the patient history, patient examination, patient function analysis. Then we come to different kind of records, OPG, CEP, CBCT if needed, or periapical or whatsoever the radiograph is needed. Then you interpret all the data, you collect, you do some model analysis, and after having all the assessment of the diagnostic data, you develop a problem list, that this is our problem list. And from the problem list, for example, you have this problem, so your objective would be this. You have this problem and this is the problem list and this is your objectives. So for example, I say in the problem list you have mild gingivitis. So your objective would be maintenance of good oral hygiene during the orthodontic treatment. If your problem list is huge overjet or severe overjet, let's say overjet is in the problem list. Now your objective would be correction of overjet. Okay, that makes sense. And one of the most important objective would be to achieve a stable result. Why we do orthodontics? Why we do orthodontics? We have some objectives which are aesthetic objective, main chief complaint of the patient, and major is the aesthetic objectives. But we cannot leave the patient and occlusion in an unstable zone. The occlusion has to be stable, and to achieve the stability and finish the treatment in a stable zone is your major objective. In a similar way, obviously, as in most of your cases, your objective is incisors, canine and molars in the class 1 relationship. Class 1 or 2 or whatsoever, based on the molar, based on your extraction pattern, we'll talk about in detail. So once you have developed the problem list, so from the problem list you are developing objectives. And how you get the problem list? From data from the diagnostic tools. From diagnostic tools. Diagnostic tool, let's say, just for the sake of example, I'm saying you have taken the lateral ceph, and from the lateral ceph you assumed and you interpreted that this patient has proclined upper incisors and high angle patient, and obviously high angle patient increased facial height and retroclined lower incisors. Let's say patient has the habit of tongue sucking, retroclined lower incisors. So this is your diagnostic tool. From diagnostic tool, this is your interpretation that you have. For example, you have proclined upper incisors, high angle patient, retroclined lower incisor, whatsoever. So from this problem, proclined upper incisors, that you have this information you have attained from a diagnostic tool. You have this proclined upper incisors, and now this proclined upper incisors is the part of your problem list. Now this upper incisors, proclined upper incisors, is the part of your problem list, and from the problem list you made the objective that the retroclination or normal inclinations of the upper incisors is your objective. Once you will do 1 or 2 case step by step, then you will come to know these steps. So what happened after making the objectives? These are your objectives. For example, I said the huge overjet is your objectives. So what if I say that for a given objective, your objective is to pass a certain exam. Okay, so this is your major objective. So one objective can be attained from different ways. My message and my point is this, that one particular objective can be attained by many different means. For example, you want to pass an exam. This is your objective. Now you are doing cheating in the exam, or you have hired a tutor for you. You are going to X school, you are going to Y school, you you are reading this particular book, that particular book. These are your alternative methods for correction of, for example, your objective is passing exam. So you can do cheating, simple way, or you are passing X book by a book. So these are just different ways to reach a single point. These are different ways. So let's say our objective in a given patient is a huge overjet. So this is your objective, that at the end of the treatment your incisors has to be class 1 and overjet is optimal, like 2 millimeter has to be the overjet at the end of the treatment. So now what you have done diagnostic data, set, this said the proclined incisors is a part of the problem list. Now you made the objective to achieve class 1 incisors. These are your objectives, and to achieve this objective of correction of overjet, now we have different strategies. You could have done orthodontic surgery, OGS, for the advancement of mandible. You can plan, for example, the patient is of 15 years of age. 15 years. You may say wait for more 2 or 3 years and we will correct this overjet with the mandibular advancement, because with the aesthetics, now different other variables come into play. Now in other variables, the patient input is very important as well. Okay, so let's say you see these proclined upper incisors as per your diagnostic tool. The patient input is this look very fine to them, and the aesthetic analysis, subjective aesthetic analysis, I'm using the word subjective aesthetic analysis, this looking very pleasing, and now you want to correct the overjet. You can give a try with a functional appliance, or you can do with the upper 4 extractions. So these orthodontic surgery, your attempt with the functional appliance after the once your growth is finished, and obviously in the borderline situation when your growth is getting slower down and you feel like your adolescence growth spurt is going to be over, you can attempt a try of the functional appliance. That is the concept of the therapeutic diagnosis. Therapeutic diagnosis means that if you are not very well sure about the success of a functional appliance, then you just give a try for 6 months, and this is called therapeutic diagnosis. In therapeutic diagnosis, you give an attempt with a certain removal of fixed functional appliance, check is it working or not, and then you can move on to the treatment optimization. Treatment optimization is based on the results. You are modifying your treatment plan, you are modifying your treatment mechanics strategies, and you are modifying different things based on the response. So this concept is called treatment optimization. What I said so far, that you attempt when you are not sure a certain treatment strategy, check it for 6 months, and after 6 months you may modify, and this modification of the treatment plan is considered as the treatment optimization. So what I said, my point is this, that this overjet correction is your objective, and this objective can be attained with your therapeutic diagnostic attempt of functional appliance. You can after 1 year, like once you are very sure about that you want to retract the upper teeth, so you can do with the upper 4 extraction, or you can may attempt. So these are different methods to achieve a certain objectives. So now the next step of the treatment planning is this, that either you're gonna attempt the functional appliance, or you are trying to attempt this overjet correction with upper 4 extraction, or you are trying to attempt the same thing with the orthodontic surgery. So how you would be able to decide that which thing you are going to do? So there is always amalgamation of different variables. There is always amalgamation of different variables that you will be considering. For example, when you attempting or planning any patient for the functional appliance, what variables you see? You see the vertical proportion, you see the lower label segment inclinations, you see the growth status of the patient. You are looking for the compliance of the patient. For example, if you are looking for the removable appliance, then for the upper 4s, the most important variables are the aesthetic. Is this going to be looking aesthetic? For example, your nasal label is already very obtuse. Then retraction of the upper lip would be pleasing, yes or no. So you will be considering all these possibilities one by one, and based on the patient input, you're gonna select the best treatment plan for that, the best suitable, reasonable and practicable treatment plan. For example, patient is coming very far away and the patient is going to get married in next a few months. That all the things are to be considered, and we are not supposed to give the plan in a paternalistic way. Like this is the best treatment plan for you. Your job as a best practitioner is this, that you're going to be discuss all the treatment plan, your suggested treatment plan, and as well as the alternative plans as well, because for your suggested treatment plan, you would be telling the pros and cons of all the options, the treatment duration, what kind of the compliance is expected for this particular kind of the treatment modalities, and other things are all explained to the patient. And this is exactly the patient who is going to choose the best treatment plan. It is the patient who would be choosing the best treatment plan for him. So these are basically the steps of the treatment planning and approaching the patient. The first step is your diagnostic data collection. And after the collection of all the data, by using different diagnostic tools, so you have to be smart enough to decide that what kind of the different diagnostic tools are required for this particular patient. Do you need mixed dentition analysis? Do you need CBCT? Do you need periapical? Do you need assessment of the lower eights? Do you need all the aspects should be evaluated in a systematic way that we have discussed so far. And after the systematic assessment of the patient, you would be landing on the problem list. And from the problem list, you will develop the objectives for the treatment. And to achieve the certain objectives, you will develop different treatment plan. Your plan to achieve this particular objective. Like the nomenclature of the upper teeth, you will be writing down different plans to achieve these objectives. And then you will be selecting the best treatment plan based on the input of the patient as well. Okay.